study that was presented earlier this year at an interventional cardiology meeting in Las Vegas, and it was called the Easy Impact Trial. So it was a very simple idea. They looked at patients who had intracoronary stents, and recognizing that it's critically important for those patients to take dual antiplatelets, aspirin and clopidogrel, for the duration of the year, they said, well, why don't we try a very simple thing and have the nurses call the patients periodically and remind them, take your medicines, this is why it's important, this is what can happen if you don't take your aspirin and clopidogrel. So in the Easy Impact trial, they took 300 patients who had a drug-eluting stent. Half of them were randomized to standard care with routine follow-up with their cardiologist, like we do every day in our offices, like I did last Monday in my patients who were stented. And the other half had regular phone follow-ups by the nurse, as you can see, at 7 days, at 1 month, at 6 months, and at 9 months, to help remind them, to educate them, and to help improve adherence. On the left, you can see the data on the adherence rates. That's the proportion of patients at 1 year who were taking their medications, both aspirin and clopidogrel. And the rates here were 90%, if you can't see, and 99% if you were in the group that had the telephone contact. Clopidogrel, similar, 91% in the standard of care, 99% in the intervention. So this means that, you know, with a very simple intervention of phone calls, 4 phone calls, you can have less than 1% of the patients not adhering to their medical therapy. So greater than 99% success. And then on the right is a different metric, the medication persistence. And in this study, it was defined as a gap of less than 14 days between filling their prescriptions. You can see a dramatic benefit to this very simple intervention of 4 telephone contacts, with rates as low as 39% persistence rates with aspirin. So patients, you know, really not filling their prescriptions, not going to pick up their medications in usual care. And these numbers are about 90% or so for aspirin and for clopidogrel at 2 time points, 6 months and 1 year, with 4 simple phone calls. But we can do even better than a simple phone call. And it's very interesting to see how this is done in different parts of the world. So the World Health Organization is very interested in these, you know, in infectious diseases, because that's still a #1 issue in many of the third world countries. So you'll see 2 examples here of infectious disease control using more modern interventions. The first one is in Kenya, and the second it was in a poor inner city neighborhood of New York City, low-income neighborhood. The first had to do with prevention of malaria. And actually, in this case, instead of patients, the research subjects, if you will, were the healthcare workers who were responsible to check up on patients, make sure that they were adhering with their medications and the treatment program. And so they took 119 healthcare workers in Kenya, randomized them to a control group, which received no additional intervention, and the intervention group that got text messages saying, how are your patients doing? Did you follow up with them? Are they taking all their prophylactic medications to prevent malaria? And report to us back and tell us what your rates of adherence were. And just that simple text message that they received periodically had a dramatic effect. In fact, it improved the adherence by 25%. And this was measured both immediately after the intervention at, I think it was 3 weeks, and then 6 months down the road. So a dramatic improvement you can see in results with simple text messages going to the healthcare workers, who then transmitted the message out to the patients. In New York City, in a study of over 9,000 patients, now at the bottom you can see, was a very interesting solution. Here they were targeting the patients were young children between 6 months and 18 years. And the thing that the medical system that they were looking at, or the outcome, was receiving an influenza vaccine. And this was back, I want to say, maybe 2 years ago, back when we were very worried about the Asian flu. And so there was a large push throughout the country to get children immunized, to get older people immunized, and those who are at risk for influenza. And so the control group was just, the usual, when you go to your doctor, get recommended to have an influenza vaccine if you fell into one of the groups that needed it. Healthcare workers, elderly, those who had cardiac and pulmonary disease, and the young. Now in the intervention group, what they did is they targeted the parents of these children. And they would send each week a text messages saying, your doctor has recommended that your son, your daughter get the influenza vaccine. Here's where you can go and get it. Have you done this yet? And there was this kind of intervention with education about, why you should have the influenza vaccine, and information about how you could get it, how important it was. And you can see, again, to the right here, by the end of the influenza season, and I think they looked at this data in March of that year, because generally in our winter is when we see most of this influenza epidemic. The vaccination rates increased from 39.9% to 43.6%. And this is a very simple, efficient, and low-cost kind of intervention. The heart study is a very interesting, forward-looking kind of protocol, and this is more similar to what I think we all here have in mind with FB communication. Now this study is ongoing, but the design paper was published last year in Cardiovascular Disorders. And the heart protocol schema now, the patient population they're targeting are patients who need to have cardiac rehab, outpatient cardiac rehab. So these patients have had myocardial infarction, or they had bypass surgery, or they've come in after coronary stenting, and it's often difficult to motivate some patients to get into cardiac rehab. So it's a very interesting kind of design. They took, and this is being done, I want to say, in either Australia or New Zealand. I can't remember. Maybe it's in New Zealand. So 170 patients, outpatients in New Zealand, who qualify for cardiac rehab. In the last 3 to 12 months, they've had an event, and they're being randomized to this health cardiac rehab program, or usual care, and it's a 1-to-1 randomization. The mHealth cardiac rehabilitation program involves frequent text messages and a personalized website that these patients who need rehab can go to. They see their data, they can see their progress, they can be reminded about their diet and their lifestyle and their exercise program. And the goal here, and then what I think is very neat about this study, is not, the goal is a more comprehensive kind of evaluation. So the primary objective is to look at exercise capacity. They're going to actually take these patients through their rehab, and at the end, see, well, how far could they go on their treadmill? What was their oxygen uptake and oxygen delivery? So that they can have an objective endpoint to compare this program, the mHealth cardiac rehab program, with usual care. Of course, there are a number of other things they'll look at in a trial like this. So they'll ask the patients, about the system. How do you perceive your health? What did you think about these types of interventions and reminders? They'll look objectively at measures of cardiovascular risk factors, like their blood pressure and their weight and their cholesterol and so forth. Then they'll look at a healthcare quality of life measure, and also look at cost effectiveness. A type of program like this, actually, to implement should not be that expensive. If you think about the expenses of text messaging, setting up websites, and feeding that back to patients, is one that now we can do, and many businesses do outside of medicine routinely. So the interactive monitoring system here, and this is just a skeleton of what we all have in mind here at FB Communication, is a fairly new concept to medicine. It's an integrated system. The goal is to improve adherence among patients with chronic diseases, and the methodology it uses is to look at each stage in the process, in the treatment program, and to try to improve interaction between the patient and the healthcare provider, be it a physician or be it a nurse practitioner. But the point is to leverage the current technologies we have, particularly in telecommunications, to improve adherence. Among the many features include reminders to the patients to take medications that can come in a simple, a variety of different forms, ways to monitor that patient's adherence, to monitor the patient's symptoms and results and healthcare status, and to record the information so then the doctor can see what's going on, the patient can see what's going on, and this will facilitate better health and adherence with their therapies. This slide summarizes some of the features of the interactive monitoring service. It includes phone calls and alarms to patients, and these systems can be set up and individualized to the patient as the patient and physician agree to. It involves phone calls to whichever number the patient provides. Then when the patient answers the call, the system will put him or her in touch with an interactive voice response. Obviously we want to look at whatever language is most appropriate and select that. It's a simple interaction using a phone keypad that the patient can then use. If the patient doesn't answer, there are ways to then reschedule calls and escalate the system, and after a certain while, depending on how many calls and what's appropriate for that disease state and for patient, notifying then the physician, hey, we can't reach your patient, we're not sure that they're taking their medications or that they're even well. So that there's a maximum number of recalls then that can be set into the system. All this is data-based so that it can be accessed by the physician who's caring for the patient. And, and depending if it's a very serious condition or an ill patient, there are ways to set up warning messages that can then go back to the physician to notify them of what's happening. So this is my last slide, and I'm glad we had a good number of people here to hear this launch of this system. So message number one, remember how we started, that adherence is a major problem. One of the most interesting studies I read last year in cardiology was this MI-free study. I don't know if you've seen it in the New England Journal. Even when we give medications to patients for free, the adherence was not very good. In fact, it increased only about 5%. So it's not just the cost of the medications that's going to make a difference here. Even in the U.S., giving important cardiovascular medicines for free left many patients untreated or poorly treated. So adherence is a significant problem. It's not going to go away easy, and it's a problem that's worldwide. The challenges are complex. Remember that complicated relationship diagram. And there's no way that we can just simply press one button and fix this problem for everyone throughout the world. It's going to involve individualized solutions, figuring out what's best for that patient, for that medical issue, for that medication. And we believe that this innovative, interactive monitoring service is one of the solutions, one of the potential solutions. It should be able to provide benefit and opportunities to improve outcomes for our patients. And it does so by targeting both the patient to improve their adherence to medical therapy, and to also target the physician to allow them to understand what's going on with their patients and to support the physician, because we're all so busy, we don't have time to be chasing down every dose of every medication for our patients. So, this is something that I think is gaining interest throughout the world already. The World Health Organization has a tremendous amount of money and time invested in improving adherence. And we're also seeing specific medical journals that are now dedicated to this field And I think you'll hear more about it as the population ages, we have more chronic conditions and better therapies. So I want to thank everybody for coming this morning. Thank FB Communication for allowing me to participate in this exciting, innovative technology. And I think we'll have some time for questions if there are any. Thank you.